This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
I was going to talk about something that's actually super commonly seen on EKGs and is fairly commonly missed. One of the things that patients will present with on an EKG that's abnormal is this pattern of what's called subendocardial ischemia. Basically, when your heart cells are stressed and not getting enough blood flow, when there's a supply-demand mismatch, that generally manifests with ST depression. When you have full occlusion and the cells are dying, that's when you ultimately get ST elevation. So just general picture, depression is when they're deprived, but still maybe some flow. And when there's no flow, totally dying, that's when you get elevation, okay? When a patient comes in and they have overall supply-demand mismatch to their heart from a variety of conditions, whether that's being in DKA, being in hemorrhagic shock, being in anaphylaxis, from a brain bleed, whatever it is, or maybe multivessel coronary disease and having ACS, they will have this picture of just diffuse ST depression. Now, the flip side of all this is that there's one lead which tends to be opposite of the whole heart. So your heart is pointing down, bottom, towards the left. It's generally pointing towards lead 2, maybe V5, V6. That's just like kind of the general vector. So opposite that is AVR. So when we see this diffuse ST depression, it's super common to see this reciprocal elevation in AVR. Sometimes you'll see this on the EKG, you'll see this ST elevation in AVR, but there's no myocardium over there. It's just like pulmonary veins and stuff. And so it's important to not see that and think, oh, that's a STEMI. It's not. It's just reciprocal to all this diffuse depression everywhere else. So when you have that, it's just really important to know what's their history. Is it the person who's Kussmaul respirations and their glucose of 600? That's the person who's in DKA, who needs fluids and insulin and whatnot, not the cath lab, right? The person who has that same picture but is in chest pain, that's exertional, relieved by nitro, that's like an ACS picture and probably does need the cath lab. So it's just the importance of history in a patient that has this pattern of elevation in AVR with diffuse ST depression. That's just the way you have to kind of break it down.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.